my education hub, that is a welcome only. So I'm teaching anatomy since 26 years. It is my great honor to present one important topic which is given by the director sir and Manjunath sir under the guidance of Dr. Virpakshi sir, that is the radiological anatomy. This is the one which is a lifelong you have to remember. This is not ends at the first year only, because nowadays all the Google search, every patient will bring with the reports and their conclusion. So that you should be the very master in all the reports reading and diagnosis. So my first step in this is, that is basics of radiological anatomy. So this is the one X-ray which is brought by the patient to you, and what you are going to observe, or it is kept for the spotting, how you are going to comment on the particular X-ray, or when you are going to write about the X-ray. First you have to think, in the first year you have to think whatever the normal. Don't go for any abnormal comment in the exam at least, unless and until it is highlighted by the examiners. Only you have to first, basic is that read and find out and comment relating that is the anterior or whatever the simple X-ray, normal, anatomical, structural related. So this is the one which is you have to remember. I have represented this. Here you can see the aorta and pulmonary trunk. Here we have the left auricle. This is the left ventricle. You are going to get the right atrium, and here we are going to get the superior vena cava. So these are the areas, these are the structure you have come across when you have studied the heart. So that if you know these all structure and its location, then only you can comment on this. This is normal, but how to read X-ray, you are going to get the. So this is a simple guidelines which is you can remember, because all the areas I have told, aorta we have told, pulmonary trunk, auricle, we are going to get left ventricle, you have the right atrium and superior vena cava. You also trace the trachea. So these are the areas you have to remember. It is kept in your mind, then only you are going to read the PA chest, whatever the X-ray. Most commonly till final year, we see that the reading or the diagnosis of the PA chest is not done properly. So that if you are studied properly PA chest, according to that you can go for the other related comments. So this is the one which is basic thing which is I am going to highlight today. How to read and how to comment, that is all. So when you see the PA chest, what you have to see, check it. So expected things from the examiners or in the practicals, in the spotting, is these points. I know that is National Commission has made the spotting, and 2 radiology is fixed question. So 5 marks each. How they have divided? 5 marks is 1, 2, 2. So in the one question you have the 3 subdivisions. So identifying the X-ray is 1 marks. Then writing the what it is a type and its description is 2 marks. Then third you are going to get the details. If the normal structure seen in that surrounding X-rays, that also you have to write. So anatomical structure, normal, which are there, that you can see it. So this is a very important one where you can comment on the PA chest. So what is important first, you have to check on the X-ray film, you have to check the name of the patient and which radiograph it is. It is AP view or PA view or lateral view. So next, when you read the date of that X-ray which is written, Now even the patient name is printed on the film. Next, identify the type of film which is used. Now we can use the paper film, digital, whichever it is there, but we don't have the all medical waste like that we are finding now. It is printed in the file with the A4 size paper also. So look for the markers, any marks on that, and technical quality of film, then external soft tissues which are seen in the chest X-ray. So this is all I'm going to guide you. You have to see these all heads in the reading of the PHS till final year. So this is the one where domes of diaphragm, you can see gas bubbles are seen in that you can see. Then free air is there. Bones, what are the bones seen in the PHS? That also you have to remember. Spine, clavicle, scapula, humerus. If it is exposed till to the shoulder joint. So this is the one which is the basics where you are going to see in the, that is the PHS. So how to read the PHS? See, these are the few important, I'm going to show the radiographs, plain radiographs, where you can see and what are the things you have to remember. Whatever I have told, the region where you have to see first. So instead of going to the labelings, as you are knowing all the parts and location of the structures or the organs of the body, first I am going to give you the guidelines to read comment on PA. First you have to see the cardiomediastinal region. So when you see this cardiac shadow and mediastinal region, that you have to see. Means cardiomediastinal structures. Second one, pulmonary structures. You have to see on the side of the heart, lung is situated, lungs are situated. So these right and left lung you have to see, that we see or call as a pulmonary images or pulmonary area. Next we are going to see the vertebral column. Then we have the bones, ribs, all that can be, you have to find out in this. So here we have to see the clavicle, trachea, vertebrae, and this is the one which is a heart shadow. And I have told you have to very much specific to see the domes of the diaphragm. We are going to get here left dome of diaphragm and right dome of diaphragm. Here we are going to get in the fundus of the stomach, we are going to get the gas shadow. So this is the one which is a normal thing which is we require. And this is the one PHS where you can remember about that is the first one, that is the reading of the PHS. I have told that is you have to highlight or first concentrate on cardiomediastinal region, means heart and its structure related. Then you have to see the pulmonary area, lung. Then I have told the vertebral column posteriorly, trachea. Then we have the clavicles and ribs, both the sides. So this is one simple thing which is you have to know and see these all areas when you are reading the PHS. So next, when lateral view is taken, so just you have to understand the lateral view of chest, where you can see the heart shadow and ribs, sternum, where you can see the highlighted sternum, trachea, lungs we are going to get, and all the vertebral column we are going to see. This is the one which is a lateral view of chest. Next, which is you have to highlight, or in the females, when we take the X-ray chest, it is we are going to get the shadows of the mammary gland. So this should be interpreted properly with the as one of the content which is we are going to get fat maximum in the mammary gland. So that should be shadowed here and you have to identify. And below this we are going to get the domes of the diaphragm, and this is the cardiac shadow or cardiomediastinal structures. So this is the one which is you have to comment. So when we see the view on the superior and as it is a PHS, as we are going to get in the city thorax and all, this is the one abnormal where you can see that is a applied anatomy. In that we have come across the clinical anatomy of the lung, where we have the tumors or any region which is occupying in the lung, that we are going to get, it is seen like in the white shadow, that you have to, this is the abnormal one. Okay, so this is the one which is a PH chest, which is on the superior, we are going to get it. So this is also same, apex of the heart we have to concentrate where it is situated. Is it cardiomegaly is there, then we are going to get the heart shadow is enlarged with the apex which is going towards the chest wall laterally. So cardiomegaly you have to remember, COPD we call chronic obstructive lung diseases, where we have the narrow chest and lung shadows are narrow made. Then we sometimes we are going to get the tube-like heart. So this is the one clinical anatomy which is you have to compare in the clinical anatomy of lung. So as these all parts highlighted, PHS, most important, what you have to see, all these which is areas I have explained you. So you can read better PHS and see what is the normal and abnormal. So this is the one view which is commonly kept for the exam. Then you have to how you are going to comment on this. No labeling, nothing. When this X-ray is brought by the patient, you have to see all the shadow normal. First you have to think in the first year normal only. Don't think comment going for the abnormal one. So first year you have to basic one is you have to remember about the normal anatomy. So here you have to see tracheal shadow, vertebral column. Then we see the heart shadow, lung shadows which are there. It is my department view box X-ray I have taken. Usually we keep for the spotting and all, and that is a V sheet. Here you can see the dome of the diaphragm, gas in the fundus. So this is a normal PH chest. So in this kept for the spotting, how you are going to write the points? First you have to tell it is a plain radiograph, or we are going to get the PH chest, which is showing the following normal structures. One is cardiomediastinal and lungs, pulmonary area, cardiomediastinal structures. Then bones, including clavicle and ribs, you have to highlight, and vertebral column. So this is the one which is including the domes of the diaphragm. So this is the one which is you have to comment on the PH chest. So this is the basic of the PH chest we have completed here with the kept common specimen in the total spottings and in the exams. So this is the one which is when we go for the applied anatomy, we have taught you what is a pleura, covering of the lung, pleural effusion. I have shown you the normal all. Here the white shadow which is filled with the fluid which is giving the pleural effusion we call. So don't think or comment that is a cardiomegaly here. Should not be mistaken this as a cardiomegaly, because you have to see heart shadow, even little part of the pericardial effusion, as well as we have the pleural effusion. So abnormal collection of fluid in the pleural cavity, pleural effusion, abnormal collection of fluid in the pericardial cavity we are going to call as a pericardial effusion. So this is just clinical anatomy of heart and lung and pleura. So this is what I am applying the clinical anatomy in relation to that is a radiological anatomy.